Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobby Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I'm joined today by two very special guests from our Environmental Health Department, our Health Officer Heidi Peak and our Deputy Health Officer Mike McGinnis. And we're going to talk about some of the things that around this time of year we want people to be aware of, we want people to take precautions for, and we want people to still go outside, enjoy the outdoors, and have a good time. And I'm glad that we have Mike with us today because Mike is a real outdoors person. Actually, Heidi, so are you, because you like to go out in the garden, tapping maple trees for syrup, and so you're out there as well. So we're going to talk about mosquitoes, ticks, and we are going to round off our conversation this afternoon with talking about hantavirus or the Andes virus, because that is something that is going on right now. And we do want the community to understand what we need to be concerned about, what we don't need to be concerned about, and what we need to prepare for. So let's start with our lovely friends, the mosquitoes. And I'm thinking about those guys because it's raining. I mean, it's misting. But when we have opportunities for water to pool in places, that creates the perfect environment. I was thinking of the bedroom environment for the mosquitoes, right? For their nesting and all. So let's talk about mosquitoes.
Sure.
What are things that we want our viewers to be mindful of, in particular with these rainy days, pools of waters, and how does that help mosquitoes? Even though it's relatively cool, you know, tell us about the mosquitoes. What's their lifespan like? How do we interrupt that, and how do we protect ourselves and our pets?
Right. Let's just talk about some basic things that influence and kind of control what mosquitoes do and don't. We're actually in the middle of a slight drought, so you haven't seen a lot of mosquitoes. They are out there, but black flies have been noticeably not present recently. They don't do well in windy situations, and if the temperature dips below 50 degrees at night, they're not out flying.
Okay.
So we can kind of gauge what the risk is there. They're most active from, I always get this mixed up and reversed, from dusk to dawn. So people who are outside during those types of hours should take some precautions. And for precautions, it would be cover your skin, use a proper, appropriate bug spray, never apply it directly on the face, pat it on the skin, and just watch for children too to see if they're getting bitten. And Bobby had referred to the what am I trying to say?
So, you know, so while you were talking, what I thought about, you said the dusk to dawn. So, you know, we've got a lot of activities that are going to start kicking up right now, like the soccer stuff.
Soccer practice,
all those things where the kids are going to be outside and babies out there in carriages with their parents. And so as you mentioned that, Heidi, it made me think about a lot of times when people are watching those kids doing the soccer, they're not paying attention to that little one that's in that little carriage, and that's where those little mosquitoes are going to be flying around, those folks.
And they have nice screens that they have for carriages that I think make an awful lot of sense. And around the home, you want to be checking your window screens as well, and then making sure that you're not just propping a door open when we get to further into the season and there are a lot of mosquitoes out there. We typically start to be concerned about the beginning of July because we'll have nuisance mosquitoes before then, but we typically don't see any sort of disease associated with mosquitoes prior to that time period.
Yeah. Now, what mosquito, I was going to say brand, but it's actually the genus, do we in the Northeast need to be aware of? So remember when chikungunya, I think I'm saying that right, popped up. That was like in certain countries, and then it was travelers that we wanted for them to be aware of. But in the Northeast, what do we want to, we've got the Anopheles, we've got different, I keep wanting to say brand, but they're not brand, species.
Yes.
We've got different species. What do we want to be mindful of? There's different infectious diseases that they carry?
Culex pipiens carries West Nile virus. I believe it's Cochleatida perturbans that carries triple E typically. But there is some crossover among mosquitoes. Certainly West Nile virus is a much milder disease than triple E, so we want to make sure that we are taking really good precautions when it gets to be about that time, or if we've been notified by the state that there is triple E someplace in our state. And that happens, mosquito testing will begin in July. But how this all started around the year, well, when it happened in New York City, they were going through a drought, so people were storing water, trying to conserve, and they were making these nice little breeding spots for these types of mosquitoes. And we learned a lot, and we now still will trap within the city starting in July again for mosquitoes. And we have a mosquito vendor that does that. And that's to establish the risk to the public. Yeah. So it is surveillance. And we also put an emergency permit for spraying if we need to. We've never had to use it because it hasn't been that significant. 2025, we were considered in Nashua low risk still. Typically along the state, the southeastern part seems to be most impacted, but Hudson was deemed moderate risk because of 2 batches of mosquitoes that were carrying Jamestown Canyon virus.
Yeah. So these different types of mosquitoes, they get around, especially with the way that the weather has been. Like, again, it's relatively cool right now. And I do believe, though, we're supposed to be getting some warmer weather. And in fact, we're supposed to be getting up to the 90s for like 2 days in a row. With the mosquito trapping not occurring to July, does that timeline ever change if it happens to warm up sooner for longer days? No.
There are a lot of resources that are expended during that time. So it's established that this is when it starts, beginning of July, and it typically will go to, say, mid-October. The only time that that's going to be extended is on the October side, because if it's unusually warm, they will extend it. But because it takes dedicated staff people at the Public Health Laboratory, they're gearing up now, but they won't be ready until the beginning of July. If something extraordinary happened, then we would probably get some assistance from CDC.
Yeah, and we are expecting hurricane season to kick off June 1st, and so there'll be plenty of opportunity for more water to fall down on us and land in places where we want people to be aware of. So Heidi, before we jump into the ticks, because that's our little arthropod that we want to focus on, for our vector viruses and vector things that we want people to be aware of. But what are the places around the home that we want people to pay attention to make sure that that water is not there?
Bird baths, animal feeding stations, like if you leave like even dog food out there and it's in a place that the water can't drain off of, you're creating the perfect environment for mosquito breeding. And it takes just a little bit, but any little receptacles, if we say that if there's water on site that you're keeping for a reason, you can put some dish detergent in it, and that breaks up the surface tension, and the mosquitoes can't stay on top. They end up drowning.
Wow.
So that's something you can do.
I never heard of that one before. All this time, Heidi, you never let me know. You never let me know about that one. Put a little drop of dishwasher. Dawn will probably do it too. Little Dawn will do you.
Yeah.
Yeah.
Absolutely.
Right. Okay. So now, we want people to be aware of mosquitoes and to take precautions against the mosquitoes and all. And we also want to talk about our friends, the ticks, because we did also learn that this is going to be a really high tick season.
Yes. So ticks are a little scary. They're vectors for disease. We have 3 main ticks in the state. the black-legged tick, which used to be called the deer tick. We have the Lone Star tick to a lesser degree, and then the other most common is the dog tick. The deer tick is, or the black-legged tick, I should say, is the main culprit for Lyme's disease, and the Lone Star tick is the main culprit for alpha. I can't quite recall the name of it. Alpha-gal syndrome. There it is, which makes you actually allergic to red meat, dairy, and other meat products.
Yeah.
So they are scary, but you don't need to be scared of the woods or the outdoors if you take the proper precautions.
Right, yeah. Now, are the ehrlichiosis and the babesiosis, are those related to the same tick that causes Lyme disease? We had a case once a while ago, poor woman, wasn't an outdoors person, didn't have any animals, her cat was an indoor cat, and she ended up somehow with Lyme disease, babesiosis, and ehrlichiosis all at the same time. Yeah, ended up in the hospital, ICU. They didn't realize what was going on until they ran the test, and that's what they found out. And so our ticks can be pretty serious for some people.
Absolutely.
Yeah.
Yes.
And then cause different types of ailments, joint pain, arthritic pain, even Lyme disease can lead to some effects that cause immobility for individuals, including some neurological things as well. And so what are ways, Mike, that folks can reduce their exposure to ticks? Because we do, so that's the whole thing, right? As the weather warms up, we do want people to get outside, right? We kicked off Public Health Week with the whole idea of let's get outside, let's get ready, let's be motivated, let's take some action, get outside, walk, run, go to the woods, go to the beach, anything to do to get mobile, right? Or just do things that help your mental health, right? And so being outside in nature, that helps with our mental health, right?
Of course.
And so what are things that we want people to be aware of to reduce their exposure to ticks, or at least if they're exposed to the ticks because we're in nature, what do people need to do?
Sure. So, I mean, there's a number of things you can do to avoid ticks. Part of that would be, and I don't want to say avoid nature, but if you are in nature, try and stay on the trail. Not a deer trail, because that might have a lot of ticks associated with it, but an established trail. Stay away from the brush, the tall grass, leaves, leaf litter, that sort of thing. Ticks will hang out on that stuff and sequester for a meal, or to hitchhike on something. I always recommend, if you're going to go in the woods or brush or anything like that, I always recommend boots, tall socks, long pants that are light colored, where you can easily see a tick crawling up your legs, and then long sleeve shirts, always a plus. You can treat your skin with DEET. That is a repellent for ticks. You can treat your clothes with permethrin, but I would highly recommend letting that dry before you put on the article of clothing, because it can cause a skin reaction. But in my experience, the permethrin is highly effective. I have dedicated sets of clothes that I wear when I'm outdoors that are periodically sprayed with that chemical, and I've yet to find any tick embedded in me in years of going outside doing that.
Now, what exactly, Mike, for our viewers, what exactly are you doing out there?
Most of the time, outside? Yeah, so most of this time of year, I'm primarily turkey hunting.
Ah,
and, so that's good for the mind, good for the body, but it's nothing to pull 20 or 30 ticks off you when you're doing that sort of activity. But
because you're sitting, right?
Sitting or walking, or meandering through the woods quietly as possible. But you can definitely pick up ticks. I mean, like I said, it's nothing to pull 20 or 30 off you in a morning of, chasing birds. But they're not embedded. My clothes are all sprayed with permethrin, so they get on and they quickly die. Permethrin, I believe, is a neurotoxin to them, so once if that gets anywhere near them, they have a rough time.
Right. And that's why you say that even individuals that are going out need to take precautions with that as well, because it can be toxic to
It can be, yes. It can cause a nasty skin reaction. And actually, if you spray it on your skin, it's rapidly absorbed through the skin, so it's not actually effective on the skin, but it can cause that reaction. So they recommend DEET for clothing and no more than 0.5% permethrin to spray on clothes.
Okay.
Or textiles, rather.
And now the DEET, we also use that for the mosquitoes as well, don't we?
We do.
We do.
Yes.
Yeah. So this will be giving us the double protection against the mosquitoes and the ticks, because the mosquitoes are going to be out in the woods as well.
Of course.
Right. Those will be the ones that your bird will get away when you're trying to like shoo the mosquito away, right?
Absolutely.
Little disruption there.
It's more the
Right.
black flies, but the mosquitoes are definitely
Yeah.
a nuisance.
Does the DEET work with the black flies too?
I think so,
Yeah.
but they're just so aggressive that,
Yeah. And they bite?
yes, they do.
They do. So there's like little critters that will be out there that can ruin a day for us. But if we take the right precautions,
Yep.
then we can have some satisfactory time outdoors and protect ourselves at the same time.
Yes.
Now, there are things that physically, or I should say physiologically, that they're drawn to, right? They know we're there because we're exhaling,
Yes.
right? We're breathing, we're just being. But that's what attracts both the ticks and the mosquitoes to humans. Is that
Absolutely.
correct?
Yeah, carbon dioxide,
Yeah.
which, as you said, we exhale and it alerts them to our presence.
Yeah.
Same thing for any mammal that's breathing as well.
Yeah. And both of these, in the life cycle, the mosquitoes and the ticks, humans are not their prime
Correct.
feeding source. It's usually animals.
Yes.
Is
Correct.
that correct? Yeah.
Yes.
Yeah. And even for like the ticks, you mentioned the deer tick, the dog tick, so it's not really a human tick. It's they just happen to take us as opportunistic meals.
Pretty much. Yes.
Yeah. Yeah.
And there's definitely a lot you can do, I mean, on your person to prevent them, and then, treat your animals, make sure they don't track anything in.
Yeah.
But there's a lot you can do around the yard, too. Maintaining your yard nice and neat, removing leaf litter, tall grass, weeds, things of that nature.
Yeah.
Neatly stacking wood piles, so to prevent rodent activity, because they will hitchhike on rodents and raccoons and all sorts of other animals.
The
so
ticks.
The ticks will.
Yeah. Wow. That's interesting. And then you mentioned equestrian. So for some of our viewers, we're not talking about equestrian with the horses, right? We're talking about questing, which is sort of this motion that the ticks have when they're trying to like hitch a ride on their next meal.
Yeah, my understanding is it's basically when they're hanging out on the like the tip of a blade of grass or a leaf,
Yep.
and just kind of having their feelers out, getting ready to
Yeah.
hitchhike,
Yeah.
essentially.
Yeah.
Crawl up your pant leg and bite in.
Yeah. So one of the things that we want folks, Mike or Heidi, either one of you can speak to this, is what do we want them to do after you've been outdoors for a while, and you've been hiking, right? Because some folks might not be out early. Mike, you have the turkey thing that you're doing or the bird thing that you're doing. They may not be out for that,
Right.
but a lot of people do like to hike.
Sure.
And so the weather is, getting more appropriate for that. And some people hike even when it's cold, believe it or not. But for individuals that do that kind of outdoor activity, and even on these soccer fields, right? So what do we want people to do when they get home after being outdoors?
So periodically, I always do a tick check as I'm walking, just to make sure there's nothing crawling up, and if there is, you just pluck them off and flick them away. But once you get home, I mean, you do the tick check. I would throw all my clothes in the dryer on high. If they're damp, I would put it in for probably longer, about 10 minutes on high. When your clothes are dry, about 60 minutes when they're damp or wet. And then I always hop in the shower and do a full once over for ticks.
Yeah.
And that's basically what I do.
Now, do they like to hide in areas, because I see you have a beard, do they like to hide in areas where there is hair, like around our ear hairlines and other areas, armpits?
Yeah, so in my experience, armpits, groin, and the head, I generally find ticks on or near. I've definitely pulled them off of obscure places like the center of my back before.
Yeah,
But it does seem like they will like a warm hiding place.
Yeah.
So,
Yeah.
you're
So
absolutely right.
and then people can tick check each other.
Yes.
Right. So
Yes.
especially with kids.
Especially
Yes.
the kids.
Yeah, you want to make sure that
Absolutely.
you do that. Now, I mean, and ticks come in various stages. So you got the nymph, adult, babies, whatever.
Yeah.
But they are also different sizes. And so what do people need to be looking for?
So the deer tick, my understanding is there's sexual dimorphism within the deer tick. The female is going to have a reddish color, and the male is going to be prominently black. The male is going to be smaller than the female typically, But the nymphs is the life stage, the intermediate life stage, where they're very, very small, and you almost can't even see them. They just look like a piece of sand almost. They're extremely small. And I'm most familiar with the deer ticks because I tend to get covered in those more so than the dog tick, which is a lot larger and is more of a mottled color. And those aren't, in my experience, they don't move quite as fast as the deer tick. The deer tick seems to move in a hurry to get to a hiding spot.
Yeah.
Or the black-legged tick, I should say.
Right, yeah. And then when they're engorged, what do they look like? Because I've seen them looking like raisins, like a little pruny.
Like a gray, small grape.
Yeah, yeah. Yeah, they're not very attractive.
No, they're definitely a little
They're not
creepy.
very attractive at all. Yeah, and so, but you'll see their tiny little, even if you don't know what it is, when you flip it over, you'll see those little legs just there, like kind of.
Yes.
Because once they get full, they just fall off.
They do,
Right.
they detach.
Yeah. Now, what are ways that people should not remove ticks from themselves?
Well, I wouldn't recommend just yanking it out because you can leave part of the biting mouthpiece in your skin, and then that can cause an infection. So we have a lot of tick spoons, which
Yeah.
at the right angle can kind of pluck the tick out with its mouthpiece intact. There's other tricks you can do, like I know when our animals would get ticks, my father would put like Vaseline on them and cover the spiracles so they can't respirate and they'll pop off, realizing it's in an inhospitable
Yeah.
environment.
Yeah, and what about the other ways of not removing, like burning them? Like some people try to burn them off, and you really want to be careful.
Yeah, you can definitely burn yourself doing
Yeah.
that, and well, the tick will pop if you burn it.
He would know.
Yeah.
Yes.
And I think that mouthpiece, you want to be
You wanna
very
make sure you
delicate.
get
Yeah,
that out.
That
Yes.
mouthpiece you want to get out.
Right. And when should people seek medical attention if they can't get the mouthpiece out? Because one of the things that we want our viewers to be aware of is, in particular, like with Lyme disease, because there's a telltale sign for a tick when it bites. You know, the concentric circle there.
the bullseye,
Yeah.
so to speak.
Yeah.
Yeah.
Yeah, so if you see that, you definitely should seek medical attention. I think the rule of thumb is if you find a tick engorged and attached to you, you should probably consult a doctor.
Yes, I agree.
Yeah. Lyme, Connecticut is not Lyme, Connecticut for not a good reason, right? So
Right.
the ticks are, northeast and here, and we are expecting to have a really high tick season. One of the other things that you mentioned, I did want to have just us talk a little bit about this. You mentioned about the rodents, and ticks will pop on those as well. We have had news abroad, probably about a couple of weeks, and sometime in mid-April, early April, of the cruise ship that had the passengers, about 40 some odd passengers that were exposed to hantavirus, which they determined was Andes virus, because then it was transmitted from person to person. So let's just talk a little bit about hantavirus, Andes virus, and then our rodents.
Sure. Let's see. For hantavirus itself, it's very rare in this part of the country. Once you cross the Mississippi, it's far more prevalent out west, where they have regularly hantavirus cases in humans, but they're not the same one as the Andes variant, where it is person-to-person transmission and not just someone becomes very ill.
Right.
And it's losing my thought. We have had some sporadic cases within the New England states, and I think that most of them are travel acquired, but for some far more wooded areas, there have been some locally in Vermont and in Maine. And if you think of either of those areas, that's where you could have a summer camp, you could have a fishing camp, you could be living right in the woods.
Yeah.
So it really comes down to how do we interact with mice, how do we exclude mice, and how do we clean up after mice as well. And so we want to make sure that if say you inherit somebody's camp and you're going in to clean it up, you need to air it out first so that some of that gets, you get some sunlight in there and just some gentle breeze as well. And then everything that you want to do where there's evidence of rodents, and you want to inspect to see if you see droppings or like the rub marks or something within a property. And then you clean all of that using a wet method. So you never want to sweep that up. You don't want to
You
vacuum
don't want to
it.
make it aerosolized, right?
Right.
So that you're breathing that in.
And that's what happens. That's how we ingest it, is we breathe it in.
Yeah, yeah. And so one of the main things that we want folks to be aware of is that this is rare. It's not typically something that we see. In fact, the last case that we had in New Hampshire was in 2019, and it was a traveler. And it was hantavirus, so it was a rodent to a human. It wasn't human to human.
Right.
But in the case of this cruise ship, human to human, close contact, prolonged close contact.
Right.
And then the symptoms mirror quite a bit of respiratory and diseases that we've seen, like influenza, so fever, cough, feeling weak. There's some gastrointestinal symptoms as well, so it could present like norovirus. And so, and typically when you think about cruise ships, when you have those types of things happen, I'm quite sure they probably thought norovirus first before
Probably.
they saw people as sick as they were, because norovirus is short, 72 hours. But this is something where the incubation period can be anywhere from 4 to 42 days. And so there's quite a bit of observation that has to occur. And people do need to isolate and quarantine with this as well.
Absolutely.
Yeah. Right now, we don't have a lot of concerns, in New Hampshire because it's rare. There was a report through our HAN that came out, our Health Alert Network, that did state that at least 2 of those individuals on that cruise ship did have New Hampshire residents. We just don't know where. And we're not concerned right now because folks aren't being released from that facility as of yet.
Right.
But we do want our viewers to understand that right now things are being monitored and watched. And if there are people that have questions about that, they can check things out on the CDC website, or give our state health department a call. Yeah. So I want to thank you guys for being our guests
Thank
today.
you for having us.
For talking about the mosquitoes, for talking about the ticks, and just giving us that little awareness about hantavirus as well. So I'm Bobby Bagley, and I'm reminding you today to have a great day today and a better day tomorrow. And I'll see you next time on Public Health Matters.